So our last session is attracting and retaining the right talent, the digital health way. And we have here with us Nandita Krishan, who is the lead organization development at Arthan, and she heads the organizational development vertical as well. Additionally, we also have Karan Trivedi here, who is the AVP talent operations and delivery at Arthan. So glad to have both Karan and Nandita with us, and let's hear them.
You want to sit? Hi, good evening, everyone. We know it's been a really long day for all of us today, but it's a pleasure to be here.
Hi, good evening, everyone. Thank you so much. We've obviously been here and we know all the good work Path and the Fest have done. So glad to be the last session for the day also, and hope we could have some engaging conversations with all of you. Should we?
I think we'll start.
We'll start. Yeah.
Great. Can we please move to the next slide?
Yeah. So, when Pallavi from the Path team reached out to us, asking if we would be open to facilitating a session into career pathways and talent opportunities within digital healthcare sector, we were also slightly we were thinking, how do we tackle this? Because as you might be aware, Arthan is yes, one of the leading human capital services organization. We have our expertise within the impact sector. We work across all the 17 SDGs. Like as recent, over the last year, we've worked with organizations involved in 14 out of 17 SDGs across the impact sector, not only in India but other South Asia and North American economies as well. We've been able to reach out and create a lot of impact in those areas within the human capital realm. We started being with a talent acquisition arm, and over the years we've also expanded into organization development services. So that is where our first conundrum came, that how do we merge digital health and the impact sector, because digital health obviously lies at the convergence of both technology and healthcare. We do over the last few years, we've obviously worked with a lot of healthcare organizations and have been able to help a lot of individuals transition to the sector and even outside the sector. But yeah, happy to entertain a lot of questions here, give you some quick snapshots about what you can expect from us in this session, and we'll also give you some snapshots, some case studies about what are some talent trends and some case studies within the digital healthcare framework. A quick introduction about myself. My name is Karan. I lead the talent acquisition vertical at Arthan. I have about a decade of experience within business and talent acquisition. I am a pharmacy graduate, did my MBA, worked in the pharmaceutical sector. So coming here obviously feels like coming back to home, because healthcare and pharmaceutical in general is definitely a passion area. After about 6 years of working in the healthcare and pharma, I moved to the impact sector, where I was associated with Dasra. I was leading their HR function, and post which over the years I have recently joined Arthan, where I lead talent acquisition. We have a strong 25-member team working, like we said, across 14 out of 17 SDGs within the impact sector and beyond. I have my colleague here. I'm so sorry.
Sorry, I thought you were going to take time. I was...
Yeah.
No, but...
Yeah, I have my colleague here, Nandita. Over to you, Nandita.
Thanks, Karan. Hi, everyone. Good evening. Like Karan said, we work together. My name is Nandita, as you already know by now. Yeah. This is probably the 4th time you're hearing my name. I lead the organization development and delivery vertical for Arthan, and come with over 17 plus years of experience. If I have to put it in a way, across different verticals, different functions of HR and organization development. While I started my career in banking sales, I realized numbers made me anxious, moved quickly to HR because I love being around people, to my mind at that time and age, that was a good career option, and trust me, it is. I won't say it is not. But again, with HR started with recruitment, moved to L&D specialist, training, facilitation, generalist profile, where I went on to lead the HR for a software organization. And over the past couple of years, I have been working very extensively in diversity, equity, and inclusion. Researched across countries, for which I have an honorary doctorate from the Ministry of External Affairs. And I'm an NLP coach. So happy to be here talking about a sector, talking about something, careers, which is very close to both Karan and me. And so I think without further ado, let's start with the session.
Yeah. I also have a quick request. I know we have, all of you are very, we can see a lot of enthusiasm in the room. All of you have waited here for us till 6 p.m. on a Saturday evening. So we also want to make sure that all of you have whatever agenda you might have in mind for this session. We try to do justice. So I have also, we have already discussed with the organizing team. In case anyone has any questions, the team might just circulate some sticky notes if you want to ask any specific questions with regards to career pathways or any specific within the realm of the topic which we are discussing today. You might just circulate those sticky notes and share it with the organizing team, and then they will share. We'll definitely have a separate AMA. We have dedicated the latter half of this session for an AMA. But if there are any specific questions, please feel free to share it with the organizing team. Yeah? Okay. We can start.
Also, quickly on that note, if we could have just 5 raise of hands, fastest hand first, to let us know what is going to be. Why am I not surprised, ma'am? To quickly just let us know what are some of the key takeaways you want to have at the end of this conversation that we're having. That will help us also route and guide our conversation with you and the further session on that. And let's start with you, ma'am, please. Okay.
So now why don't you go first?
What is probably a takeaway? What makes you sit at 6 o'clock on a Saturday evening for this conversation with me and Karan?
Because I just did not realize it's 6 p.m. It was so interactive and interesting. So I just did not think that it's 6. So
that's brilliant.
Yeah.
Thank you so much.
Thank you. Can we have some other people who? Yes, yeah. Please. Yes, please.
Hello, ma'am. I am from a startup. So basically, I want to ask that how to retain a good team member who has already one offer from a bigger company from the corporate sector. Like how to retain that team member in a startup.
Thank you. We didn't get your name, sorry.
Rishabh.
Rishabh.
Perfect.
Thanks, Rishabh.
We'll cover this towards the end.
Yes, please.
Yep.
I think we have a raise of hand here also.
So I'm going to do, I'm a techie. So this question is how to create an atmosphere which is both healthy, environment-wise, and also with competitive salary for techies in this health space.
Great question.
I also have one question.
Please.
So I am a public health professional who is working in digital health right now, but my background is in public policy. So I want to know, since public policy has become such a saturated sort of a domain, what do you think are the kind of skill sets that a lot of companies are now looking at while hiring people for public policy as well? So if in case you can also give some insights on that, so would be great.
Lovely.
Sure. I think just one last question we'll take. Yes, please.
I would like to know if you could put some more light on the Earthen's work in the states, like apart from the center, how do you engage in the state, and also especially in the domain of digital health.
Right.
So, yeah, thank you.
Okay, thanks. Thank you. Yes, please. I think we give you that benefit, Pallavi, to ask the question.
So I don't come from a health background, but I'm working in health. So I come from a communication background. So health communication is something which is now considered as the need of the hour. So how can partnerships, communications be leveraged in the health sector?
Great, thank you. I'm sorry, you'll have to put it on a sticky note. I'm done with 5. So you can put it on a sticky note and hand it over
Yeah,
to...
one more person, right?
No, somebody raised a hand there.
He raised it. Like, I mean, we can give one more. One.
चलो, Karan कह रहे हैं तो दे देते हैं.
All I'm trying to do is I'm just trying to plot what are the themes coming out. So we might just like do an AMA and scrap the presentation if that's what the audience is looking for. Yeah, please.
How is retaining and training HR or the workforce very different in healthcare vis-a-vis another sector?
That's a good one, thank you.
Right. So the themes so far are some insights on how to retain. So retention is on people's mind, especially people who are from employer side, how to retain, how to ensure competitive salaries, especially from tech background and in general also. And then as one of the organizers asked around public policy, what are the career pathways if you are a public health policy professional moving into the sector? And yes, similarly, as public policy, what are the scopes for health communication? And yeah, again, retention is what he asked. So I think a lot of themes around what we essentially do, talent acquisition and organization development. So maybe we just do a quick run through of what is the scope of the entire sector and what you can expect. And then I think we quickly move to addressing some of these questions which you have through the AMA format, right? So I think let's just do that. Someone has raised their hand. Okay, they're giving us sticky. Yeah. So yeah, let's quickly move to the presentation and then we move to the.
So we'll try and keep it as quick as possible and not do
Yeah.
a death by PPT for all of us here.
Yeah.
And so moving on, we had thought of starting with a quiz actually, just to get a gauge of, while we all want to build careers in digital health, how much do we really know about it? Right? It's good to want to do that, but how much do we really know? So we're going to have 5 questions on the screens, both of them, and would love to have hand raises and get answers. The person who answers 3 out of 5 gets a good evening as it is. So we don't have anything. But you'll as it is have a nice Saturday evening and a Sunday morning to wake up to. But
Personal milestone.
yes. So these are the questions. The first question, how many digital health vacancies, job vacancies, exist in India currently? Any wild guess?
Take a wild guess.
Yeah.
Yeah, because obviously this is a very sector. It's not, we're not targeting one segment of it, but just to give you the understanding, this will give you a sense of how, what is the magnitude of the opportunity in the entire of digital health ecosystem, right? So anyone wants to take a wild guess?
Anyone? Yes? No Googling, please. Keep your phones away. 150,000, someone said. 800 to 1,000.
Okay.
2 lakh. Wow. 1 million plus. Okay? Sorry? 3 to 5 lakhs. Okay, 10 lakh to 50 lakhs. So we are talking about lakhs mostly.
Lakhs. Great.
Great. Okay. Yeah.
No, I mean, I think it's somewhere between what, sir, you said, somewhere around 5 to probably around 10. Because just the scope
Correct.
is so wide, right? You have employers right from the healthcare ecosystem, pharmaceutical ecosystem, generative AI is coming big time into the digital health space. You have a lot of impact organizations recruiting big time for different programs. You have consulting firms. You have organizations from the preventive side of things, which could be your wearable industry or curative industry, which is pharmaceuticals, e-pharmacies, and especially the consumer-facing side, which is your insurance, everything. So the scope is huge, and that is what we wanted to give a sense of first.
And since the scope is huge and we're talking about lakhs of job vacancies, what could be some of the common career roles which exist? Take a guess. What could be like 1 or 2 or 3 common career roles which exist in the digital health space? analyst and project managers, program managers, developers, okay? I'm sure you would agree too, since I remember you saying tech and health. So yes, yeah. Someone from this side, we've had 3 answers from here. Yes, sir. Okay, medical directors and clinical professionals.
Good to have clinical representation in the room.
Field coordinators. Excellent. Researchers, yes. Consultants who are for heading innovations, health tech innovations. Okay, okay. So that's like a huge look at the type of career opportunities which exist and the number of opportunities that exist, right? It's not limiting, it is actually a huge basket that we're talking about. Which brings us, अगर इतनी opportunities हैं, oh, and are we all okay if we break into Hindi in between? Yeah, great. So अगर इतनी opportunities हैं, इतने roles हैं, what stops us from moving to digital health as a career option?
As a provider, I see a lot of resilience is there in security and privacy when they think about putting digital health in.
So data privacy is a challenge which users usually have,
Yeah,
is what you're saying?
yeah.
Okay.
Users have and have concerns.
And from a provider side, if I go around hospitals, they have the security concern a lot.
No, great point, great point.
Yeah.
Anyone else?
Yes, sir.
These were from patient and hospitals. So apart from patient and hospital, from healthcare providers, they are already overburdened with work. So for digital health solution, most of them we need data. But the doctors and nurses are already overburdened with seeing patients, and they don't even have the time to talk with patient. How can they document the conversations in a transcript manner and record data? And if we have bad data, then we cannot do anything with developers, data analytics, and machine learning engineers. So that's the biggest thing keeping us away from the digital health solutions.
So could we relate this to digital literacy in some form?
Data
Literacy
analytics.
is like incapability kind of thing, but what I am talking about is the time as a resource. So on clinical setups, they don't have the time to type or scroll through the screens while interacting with patients. If you look at the government hospitals or
Sure.
overwork, like seeing the patient queues and all.
Sure.
So it's slightly different thing than literacy.
No, but
Thank you.
great point, I think. We'll just take one more. Yes, sir. True.
Yeah. So
And-
I wanted to say a point like the existence of legacy systems, even though सबको AIML करना है, but nobody wants to afford GPU. सबको AIML करना है, but scale कैसे होगा ये किसी को पता नहीं है. उतना GPU कौन afford करेगा? Whether government is going to buy it or we as NGOs or like development partners are going to afford it. AIML छोटे scale पे तो कर दिया, बड़े level पे कैसे करेंगे? So this is.
No, that's the conundrum. How do you replace or coexist with legacy or traditional systems? Great.
Yes, ma'am.
We are implementing digital health to reduce the burden of the healthcare professionals. But currently, at this point in time, it is not doing that. Like, we have increased the burden of doing multiple entries in different portals, which are not interoperable, which do not interact with each other, along with working at the manual registers also. When I asked the same question to one of the nurse in PHC that आप क्यों maintain करो, आप RCH portal पे, अनमोल portal पे कर लो. कहते मैडम जब हमारा assessment होगा तो NQAS लक्ष्य इन सब के लिए हमें manual registers दिखाने पड़ेंगे जो which are almost 40 to 45. So we claim to like reduce their burden, but that is not happening.
So it is implementation only on paper and not in spirit, actually.
No, they are doing both the work. They are doing manual also They're doing digital also. So instead of reducing it, we have just increased the burden as well.
There's lack of clarity on how to move forward in this. Correct. Correct. I think we'll take the last one, yes.
I understood your question entirely differently. I thought you asked what is stopping people to get into digital health careers. Did you ask that or did you ask
There are
what?
two ways to interpret this question, and we
Okay.
love the diversity of answers we're getting actually. So, yes, we would want your opinion also on what stops you from entering into digital health as a career option.
Okay. So I myself have found digital public health as a career very recently.
Okay.
I have a digital health background entirely in EHR, EMR, and then I switched to public health. And somehow now it has become like a combination of these two things. What I found difficult was that it's very like on the general portals or job portals where we are searching for these jobs, I did not find anything in the beginning. It's only on LinkedIn I'm speaking to other people, I'm speaking to someone working in public health and they are working on a solution, digital health, and then they're like, there is this company doing this work. That's how I found my way to a digital public health job. But in the normal job portals, they are not advertised as such, or they're like, हम लोग को MBBS background वाला चाहिए to do a digital health. I'm not MBBS, but public health is not just for doctors, right? It is a much more multidimensional thing than just clinicians.
Yeah.
So I found it initially, every job I would see, MBBS, BDS, chuck it. Then everything was like that, right? An experience of like 7-8 years in public health. So I think the job requirements were very like unrealistic.
We were just talking about it,
Restrictive.
I and Karan, marrying the, what was that, Karan, that you said? The two aspects of being, of marrying the generalist and
Yeah.
the specialist
Generalist and specialist, yeah. Yeah.
point
yeah.
of it.
Yeah.
Yeah. Yeah.
And I'm finding it very hard to do right now, but probably I will have to do it, if I have to be a specialist in tech to be able to survive in digital health,
Yeah.
digital public
No,
health.
we'll definitely touch upon some of these aspects and can also have a one-on-one
Yeah.
or during an AMA. But
Right,
thank
right.
great point, great point.
You want to speak something? Okay. We'll just
Last.
take that and then we'll move on.
I think one final point I'd like to add is the lack of, at least in my knowledge, the lack of a kind of an accreditation system or, a educational pathway for such a diverse, multi-sectoral field as an evolving field as digital health. I am not personally aware of any sort of, course or certification or pathway that exists for education and upskilling of existing public health professionals who may want to aspire to pursue this as a career pathway. So
No,
there are a
absolutely.
few short programs that are coming around, but again, like for example, there's a course on Coursera, but a Coursera subscription costs around 33K, which is not easy for an entry-level professional to, invest in right away. So yeah, I think this is one big problem which prevents people from also identifying as a digital public health person working in this field.
So the skill set divide is what we're also, skill set and literacy, the digital literacy, the capabilities and skill sets required.
Yeah. In fact, that is a problem which
Yeah.
exists
Yeah.
in any sector which is on a constant evolution stage. Because nothing is set up, there are no set rules or what you need to be to achieve a certain level. You will always have to constantly keep upskilling and adding things to your portfolio to make up to the latest trends. So that will always be a challenge. Yes, please.
Yeah, just a very small point. I think the education system, the eligibility criteria needs that kind of change.
Yeah.
Why? Because this happened with me when my application in India for public health course was rejected. I came from a nanobiotechnologist background. So I applied for an international course, and I got full scholarship, stipend, everything to study over there. So I think maybe this also causes brain drain and the challenge that we face at present. So I think maybe if you can also connect, or you might be already be connect with the universities that are bringing in this public health and digital health course, I think then it might solve a big problem, because I know how difficult and how disappointed I was. So, yeah.
No, thank you. That's
Yeah, we're touching now on the demand and supply
yeah,
of
which
roles and talent.
which actually makes me think maybe we should skip a couple of slides, Karan.
We do have a very well-informed audience here.
Yeah, so thank you. I think that question helped.
Yeah, we might want to move past some of the things which we've brought together. But yeah, absolutely. So a lot of things which all of you spoke about, very relevant points, and I mean, we will try to do justice to as much as we can. And some of the trends which we've seen, and this could be a very, you could interpret this from an organization point of view or as well as an individual point of view. What are some of the trends which we are observing, both as what good organizations are also doing? One of the first thing is what people are really focusing upon is value-based care, where, and when we see value-based, I mean a lot of impetus is on providing low-cost care, or merging different services into bundles. And that is something which we are seeing, whether it is via an insurance service or a lot of organizations bundling services through, for example, most recently, Narayana Hridayalayah, they introduced their massive insurance scheme. Now, if you see you might then ask yourself, if Narayana Hridayalayah can introduce such a scheme, which is such a low cost but high value service provider, then what are the other institutes or organizations also doing? So a lot of focus is definitely there on value-based care, which is definitely coming up.
There is also something that applying digital tools helps in. I would actually want to avoid using cutting costs. I would want to say it is efficiency of processes. It is a quicker turnaround time when you when you schedule an appointment on an app with a doctor in Medanta, vis-a-vis when you call Medanta and you say, I want a appointment with so-and-so doctor, right? So instead of cutting costs, I would want to rephrase it by saying process efficiency for all of us. Whether it is the end user, which is the patients, whether it is for the doctor in managing their calendars, whether it is for the coordinators who work with patients in remote care also. So that is one of the biggest advantages and trends of a digital transformation also.
Right. Which brings us to how can then data support, and how is data actually supporting right now? And the scope of data and analytics is so wide. Like, we recently came across several studies where insurance companies are using AI, generative AI, to predict what can be a claim prediction, what it could look like, or simple aggregators, other aggregators predicting demands of what a consumer might have, whether it's an e-pharmacy or a mental health program, right? So some of you asked about what is the technology implication, or how do you make those transitions. I think it all starts from the fact that what are you actually passionate about? I think because healthcare is an area, all of you are sitting here because you are passionate about the function. It all starts from what is the difference which you can offer, what is the value you bring, and then you target the services which you feel is more adaptive to technology. In today's age, where we see more and more application of technology with some of these players which are in insurance, which are in mental well-being, which are in pharmacies, aggregators, bundles. So I think identification of that opportunity becomes very critical. Yeah.
True. And when you identify and analyze the data and come to the place where you say this is what is needed, is where you start reinventing your EHRs and your EMRs. And Once you start doing that, it considerably brings down the efforts of the clinician and even, helps the patients have better access. But just like Rome was not built in a day, this will take time. All these digital transformations will take time. So, ma'am, probably, your representatives, your medical reps your nurses, they will have to, for a couple of more years, until we actually reach that level where we say, yes, we are at a place where everyone in our country will be able to manage EHR or an EMR without any loophole in it, or manage any documentation on an app or a software which will bring them to process efficiency, value-based care, and all of this. It will take time. And we'll just have to be patient because technology also keeps changing. So when we talk about digital health, it will continue to evolve. We will have to upskill, we will have to reskill, we will have to look at, and we will talk about it in a slide later where we will take you through what are some of the top technologies which are transforming the sector also, right, from a career perspective. But this is how digital transformation trends are taking place in healthcare. And these are just a few of them. This is not even an exhaustive list. But just like there is digital transformation happening, there are trends coming up which are helping the healthcare sector up themselves and be a part of the whole global digital world. The same way, digital health organizations are also integrating health and services. Right? So what you see on your screen is actually a pictorial representation of how digital health organizations are integrating health services and specific services to either be an aggregator or a healthcare provider, and work in a way where they're able to deliver the demand of expertise with the help of technology. Right? Now, what you see on your screen is essentially where we say that the demand is, the first quadrant, if you will see over here, is the integrated health aggregator, which essentially covers a wide variety of services, including like Practo or 1MG. Right? They cover consultations, scheduling, teleconsultations, video consultations, lab sampling. You can get your patient records over here. These are what integrated health aggregators do. So, and we'll link this to the career path also coming way, but in the upcoming slides. But as of now, what we want you to understand is what are different digital health organizations offering in terms of services, right? The primary focus in this category, if you will see the integrated health aggregator category, the primary focus is differentiation through better health information sharing with partners, making it easier, and their family members without having a brick and mortar model. Very simply put. That is what essentially the first quadrant talks about.
Likewise. Great. And then what we see is, I mean, arguably like being from healthcare, like healthcare providers are like still the biggest employment generators and also attract the most significant investments also, because they will obviously form the backbone of the industry as well. So again, a lot of innovation happening there also with regards to how they can cover different set of services. This becomes a little more specific in nature, where we are not talking about aggregators will probably try to bundle as many services as possible, but I think healthcare providers, their focus will remain largely in-house and largely creating more exhaustive solutions, which takes us to the non-exhaustive set of quadrant, which focuses more towards moving towards more service orientation, which is diagnostics, whether it's general, like whether your organizations like SRLs or Metropolis or something which is more segment oriented, like a thyrocare, right, which is more towards thyroid. Exactly. So I think that is where we are also seeing a lot of trends shifting. Either it is more service specific or it is more integrated health.
And while we look at it, while we're looking at the service side of the diagram, when we look at service-specific aggregators, which is a very niche area where you don't have many organizations working, they are segments of probably healthcare delivery, operating as information sharing platforms with consumers, and they have a limited direct healthcare provision. So you would not find many healthcare physicians, clinicians in this area, right? Which is what makes it niche and unique right now. But this plays a role to inform the customer, to provide certain information related to their health records.
And that is where, ma'am, I think to what you pointed to, there you will always find in some categories, the organizations or institutions will always prefer someone over a clinical, prefer someone with a clinical expertise over a non-clinical expertise. Yeah. So perhaps a change of outlook or strategy from your end could be targeting organizations from a different quadrant altogether. Where you can do a similar set of activity, but which is more generalist in nature rather than specific in nature. Of course.
No, totally. This is terms and conditions applied, non-exhaustive.
Yeah, this is non-exhaustive.
So
exactly. Okay.
Sure. Of course.
Yeah. Of course, of course, of course. No, no, of course, of course. And we are the representatives of the impact sector, so I definitely echo what you are also bringing to the table, what you are illustrating to. And even within the dev sector also, I think we have not put it here, but there are different organizations doing a lot of different kind of work. Yeah, please, Isha. Yeah, we can hear.
We can hear you.
No, no. It is absolutely impossible for impact sector organizations and private organizations to work independent of each other. So for example, there are players obviously like BMGF obviously is one of the biggest examples of that, right? They will not only fund the sector with the work a lot of organizations do, but they will also very actively engage with other private and the government space, even Tata Trust for that matter. A lot of work which Clinton Health Access also does. They would have a private entity, but will also very actively engage in programs. So, I mean, these are still obviously bigger players. Another interesting trend which is coming up is not only these implementation organizations, but there are a lot of impact funds taking a lot of interest. There are organizations like ACT Grants. There's another organization like Microsafe Consulting, who do very specific projects with impact sector organizations as well as private. There's a lot of public-private partnership there. But obviously their work is more generalistic in nature. They will approach it from a public policy, health lens. Huh. Yeah. Yeah, 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 yeah. Yes, yes, yes. They're always on the lookout. Yeah. 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 Yep. Absolutely. Like all of these organizations will always be on the lookout for program managers, project managers, and they would, how they would look out, they would associate it to specific programs. Like for example, someone like a Clinton Health Access would be on the lookout for someone who would be a project manager for their HIV/AIDS immunization program. There will always also be a correlation between sanitation and healthcare also. Right? So if you then go dive deeper into it, you entering a rabbit hole there. Right? But yeah.
In fact, there are many mental health organizations who are looking out for developers, who are looking out for project managers, who are looking out for therapists. So it's a mix of clinical and non-clinical talent pool that they're looking at, right? And in today's time and age, post-COVID, mental health has become a very important thing, right? So that is another career area, career opportunity, which has a plethora of opportunities for you as we talk about it, right?
Maybe we can move to some case studies and then we take some AMA.
Sure, I think let's do that. So we'll take you through a couple of case studies to make you understand, and so
just give you a sense of what are some innovative practices organizations from different streams of work are doing with regards, and also that will give you an idea of talent practices also which they are doing along with the work which they do.
So probably the case studies is going to give you an insight on what to expect if you are employed in the digital health space, right? This has talent strategies, retention strategies, and we've tried to keep it a mix.
So obviously first everyone knows what Practo is and what they do. And considering the rate at which Practo also grew, now we were also thinking twice whether we should bring Practo in, because obviously Practo, they saw a lot of highs, they're also seeing a lot of lows of late. But somewhere between the highs and the lows, they obviously did few things right. They were one of the early implementers when it comes to the digital healthcare space, especially they revolutionized online consulting when they first launched, right? And obviously that was the backbone, obviously was adopting a lot of talent strategies and focus on a lot of focus on culture, where they built a lot of work around skill development, definitely hiring fast was one of the things, but they, through skill development and other practices, they adopted some really strong talent acquisition practices where they hired for the right kind of people. They created like a capacity building center where they focused on attracting the right kind of talent from different premier institutes, as well as some upcoming organizations offering through a combination, offering packages through a combination of competitive salaries, succession planning, stock options. So a lot of things they adopted to retain some of those talented people. And obviously over the years, they were able to build a strong and talented workforce. Obviously because one of the possible reasons, apart from some service related challenges, a lot of the space itself has become so segregated. It is difficult for a single player to survive. So obviously the revenues would have also decreased, but at least it set a precedent. It was one of the early adopters, and they became what they became because of some very interesting talent practices from their side.
No, absolutely, and I think after this case study, we would want to move to another case study, which is, okay, so we'll take up this one only. We had thought of another case study. Actually, no, hold on. Why not? Technology comes in handy everywhere. So let's just go through another case study. You might see a different one on your screen. We apologize for that. We want to take you through the case study of another AI technology related mental health app called YSA, right? Now, what YSA has been doing is that they've been targeting mental health, they've been targeting behavioral competencies and behavioral issues in people through, and have provided an access to professional therapists, not just in India, but it's a global app, okay? The good thing about YSA is it's an AI-based app. It is something which, and something very similar to YSA is also the PractoSeal app, which brings another element to digital health, and lets people take care of their mental health by giving them, by making 3D images of animals as pets, which they come back home to. That is taking mental health and dealing with isolation to another level. One of their most branded products is Seal, S-E-A-L, the seals that we see. It is able, you can pat the seal in a 3D image. You can feel as if it is right next to you. The seal makes noises. It talks to you. If you talk, it responds to you. And that is how they've been able to help a lot of people come out of depression and isolation. It came up at the time of COVID. Not very prevalent right now, but it did. Some of the talent strategies that these organizations have used are integrating AI and human synergy. Very simply making use of what is the need of the hour. So that is one of the talent strategies. They have hired mental health professionals, of course, to deal with the distress lines. But they have also added AI technology along with it to create a better user experience. Secondly, they're continuously innovating. While they started at a time when isolation was the in thing, they know they need to move beyond isolation and work on mental health disorders also. So they are continuously innovating, offering a professional growth from the lens of something that I think someone was sitting here who had also asked: training, personal goals, development, lens. So when you're constantly working in an organization which is innovating, you need to innovate yourself also. And that's where self-development comes in, right? This is another case study that we had, and the third case study.
So another area which we wanted to showcase was again insurance. I think insurance, the rate at which the insurance industry is growing, along with some of the other aggregators, is just maddening. The way they are adopting technology, the way they are bundling services. And there are several players here, right from Past Care to Plum. We are looking at, we thought of giving you an instance of something, of an organization called CoverFox. Now the beauty is, some of these aggregators or insurance providers will not, essentially they will have functions right from customer facing role as well as some elements of clinical roles also. One of the trends which we are seeing is, along with their bundled services, these insurance companies are giving you access to a mental well-being practitioner. These insurance organizations are also opening a combination of digital consultations as well as a brick and mortar consultation model. Organizations like Pascare, CoverFox are now starting up in-person clinics where they're employing MBBS doctors to start up something which is like a if you have taken an insurance through their through their subscription, you can avail discounts at their, or if it's a corporate insurance, you can go and avail insurance. You can avail consultations from their personal store also, where the doctors are sitting for you. So it's a combination of right from healthcare practitioners to customer-facing roles, a lot of technology-driven work also. So what CoverFox essentially did was, amongst their talent strategies, they wanted to first ensure they have a very strong customer, like a very strong customer-facing team, as well as a very strong tech team, to ensure that their interface is smooth, because customers will be only interested when the interface is smooth. So they invested a lot in tech, a lot of tech hiring, and along with that, a lot of customer-centric roles, right? And along with that, they brought some services around wellness programs, innovation labs, which became a very well-rounded product offering, right? So I think that is another case study. We are almost out of time, as we've been indicated.
Yeah, so we'll, and just add one point to it, and then we'll take up a few questions. While these case studies that we spoke about are more from the corporate side, in the social sector also, there are a lot of organizations which are worth being involved with. Organizations like, obviously, Path. there is Care India, there's Jafigo, there is Site Savers India, there's HelpAge India. All these organizations have brilliant talent management strategies where they are very keen on investing in their employees from the lens of a retention and are open to different sources of information to understand what is it that they need to meet to beat losing a good talent to the market, right? So, I would take this liberty to say that at Arthan we do compensation benchmarking. We have clients who come to us and say, we don't want to be benchmarked only in social sector, but also outside of social sector, to understand what is it that we are actually dealing with.
Yeah.
So organizations, even in the social sector, are doing a lot of work and be more aware that talent needs to be retained and retention strategies need to be, looked at from different point of views also.
And it's always a good sentiment, right? I think along with education, healthcare remains one of the biggest employee generators and employer in the impact sector. So like Nandita touched upon a very good point where, yes, we do receive a lot of inquiries from organizations around what could be a good compensation. A lot of these organizations, which Nandita mentioned, even beyond them, like even NASCOM does a lot of good work, Arman does a lot of good work. And the more and more we see, I think they're trying to come as close as matching or giving competitive compensation, and not just a compensation point of view, but a lot of benefits to retain employees. And we personally have hired for roles which are ranging from project managers to communication leads to now we are also receiving inquiries for hiring someone with UI UX expertise. Who would have thought an impact sector hiring for someone with UI UX expertise, right? And obviously then there are this other side which is your impact funds or impact consulting organizations which have dedicated focus to healthcare. So we do get inquiries for hiring someone who's a health lead who will focus on outcomes or work in a public-private or a policy advocacy kind of a role. So I think the scope is varied. We've hired for a lot of medical director roles also within these organizations. So I think no way the impact sector is behind it. It's always going to be collaborative.
Yeah. I think with that we'll open to an AMA. We did have more content, but I know we both know you are very aware and have very specific questions. No worries.
No problem.
Can we take one question? Any one question, if that works. Just one question. Does anybody have a question, or have you written on a chit?
No pressure. No pressure.
Sure.
So you want to take something up specific? We have around salary negotiation, public policy related, health
Salaries we've
communication.
committed.
Why don't we talk about retention and training?
Yeah, actually. So retention and training, somebody picked up saying what needs to be a strategy if you want to retain talent, if you want to, what are some of the training trends? Surprisingly, they are not very different from non-health sector. I think wherever talent remains, and that's something that we always try and take forward. Of course, technical expertise needs to be covered through different certifications. For digital health, this could be a CHIR certification or an FRPS certification, right? Or any other analytics certification which you want to pick up. So technical skills apart, whichever industry, whichever sector you stay in, some very general trainings like leadership roles, which is also something you see on your screen, right? So leadership, management, research, how to be up on your time management, how to be up on your, communications. These are some of the trainings which need to be given across levels, irrespective of IT, non-IT, digital, non-digital. And organizations need to invest in this as something that employers need to invest in this as something that builds greater career pathways for their employees rather than restricting them. So from a retention point of view, of course, being up to date as an employer, understanding through employee engagement surveys, what is it that your employees need, or understanding through a competitive benchmarking, what is it that the market is offering, always helps. Technical skills, upskill always helps. But in addition to that, you need to have trainings and mentorship programs, coaching programs, to even guide your employees on what is a career pathway they want to take.